In this video, you'll learn the CSSRS and how to use it. Let's get started. This is what the protocol looks like. I'm going to break it down and guide you through it. Then afterwards, you'll be able to practice using the protocol with the help of our AI-powered instructor, Bella. Let's take this one step at a time. Start using the protocol by asking the first two questions, 1 and 2. These questions are key indicators for suicide risk. You should ask first, have you wished you were dead or wished you could go to sleep and not wake up? And have you actually had any thoughts about killing yourself? If the answer to the second question is yes, proceed to the other questions. If the answer is no, skip to the last question, question 6. For questions 3 through 6, you should ask, have you been thinking about how you might do this? Have you had these thoughts and had some intention of acting on them? Have you started to work out or worked out the details of how to kill yourself? Did you intend to carry out this plan? And have you done anything, started to do anything, or prepared to do anything to end your life? If yes, was this within the past 3 months? Once you've asked these questions, it's time to evaluate the protocol results. If the answers to questions 1 or 2 is yes, the risk is low. If the answer to questions 2 and 3 is yes, the risk is medium. If the answer to questions 4 or 5 is yes, the risk is high. If the answer to question 6 is yes, but not within the past 3 months, the risk is medium. If the answer to question 6 is yes, and it was within the past 3 months, the risk is high. If the user matches multiple evaluation criteria, always take the higher of the risk levels. If the risk is low or medium, direct the person to seek behavioral health care. In the school or community setting, that might mean contacting a counselor or other trusted adult that handles mental health concerns. If the risk is high, get immediate help by calling a crisis hotline like 988 and stay with the individual. Do not leave them alone until they can be evaluated. If you're in a school or organization setting, you should also notify a mental health staff member like a counselor, school psychologist, or social worker. Again, never leave an individual with high risk by themselves. In general, if an individual says yes to any of the questions in the protocol, they should seek behavioral health care. But if they respond to questions 4, 5, or 6 with a yes, get immediate help and stay with them until they can be evaluated. You should familiarize yourself with the processes in place at your school, hospital, or whatever environment you are in so you know who to contact if a situation arises. We know this was a lot of information, so we'll be sharing the written directions as well as an infographic to help you understand the protocol. Then you'll start practice using it with our AI instructor, Bella. Don't worry if you don't get it right away. You'll get feedback and can continue to practice it until you have a handle on the protocol.